Hello everyone, I am your doctor Divya N Raj, working as consultant ophthalmologist in Manipal Hospital Malleshwaram. Today I am here to give you a few information regarding the ill effects of hypertension in the eye. So most of the people, when they come to us, they ask us that whether really eye gets affected in the hypertension. So our answer is yes. So let's discuss one by one. So what happens is, whenever there is increased blood pressure in the body, the same pressure gets transmitted to the vessels of the eye, and that is the cause for all the ill issues which happens in the eye. So what happens is, whenever there is increased pressure in the conjunctival vessels, so there can be bleed in the conjunctiva. We call it a subconjunctival hemorrhage. Patients, before sleeping, they will be normal, and early morning when they get up, there can be bleed in the eyes all of a sudden without any other cause. So when you find such case, then you will have to meet your doctor as soon as possible and find out whether your blood pressure is normal or not. And the intraocular pressure also gets affected by your blood pressure. So whenever there is increased blood pressure, the intraocular pressure also can increase, and this leads to a disease called as glaucoma, which is again the leading cause of blindness right now. So whoever is having hypertension, they are supposed to get screened for their intraocular pressures. In coming to the inner part of the eye, that is the retina, there are a lot of blood vessels in the retina as well. There are certain major vessels like central retinal artery and central retinal vein, which supplies the optic nerve of the eyes. So whenever there is increased pressure in these, so there can be blockage in these vessels, and which can cause damage to the optic nerve, and there can be reduced in the vision. There are certain small vessels in the retina which can again cause a lot of bleeding because of variation in the pressure, and this bleeding probably initially will not give you any kind of symptoms, but as the bleeding proportion increases, then you will have a lot of disturbance in the vision. And there is something called as papilledema, which can happen in people whose blood pressure is not under control for many days. Papilledema is nothing but your optic nerve gets swollen, secondary to which your vision gets affected. Lastly, there are eye nerves, that is the oculomotor nerve, which will be supplying the muscles of the eyes. So this oculomotor nerve stroke can happen in patients with hypertension as well as diabetes. So what happens is, you will not be able to move your eyes because the muscles of the eyes have got affected. So all these ill effects can happen secondary to hypertension. So the only way to find out is the early detection of these signs. So my suggestion for you is, if you are a hypertensive patient or anyone at your home is a hypertensive patient, so please get your blood pressure checked regularly. Along with that, take the medications at the proper duration what your doctor has suggested, and along with that, you will have to get a detailed eye test just to rule out if there is any kind of this problem. And if there are any problems, then we'll ask you to come for a follow-up regularly, or if there are any medications or any treatment to start with, we will be starting that. So the early detection is going to help a lot. So if you find this video helpful and informative, please like this video, share with your family and friends, and if you have any queries and questions, you can put it in the comment box. We'll try to answer it as fast as possible, and please like our page for such useful videos. Thank you.